can feel it coming on. Guess the player.
Assalamualaikum warahmatullahi wabarakatuh, and hi to everyone. My name is Nur Wahida binti Tumiran.
Hi and Assalamualaikum. My name is Nur Faizah binti Ibrahim from BA1185C.
Hi, my name is Nur Aliya binti Baharim. I am from BA1185C.
Assalamualaikum and hi everyone. My name is Munirah binti Mama Yusoff.
Do you know what DID is? DID is multiple personality disorder and was formerly known as dissociative identity disorder. People with DID develop one or more alternate personalities that operate with or without the person's knowledge of their primary personality. Dissociative conditions are mental diseases in which memory, consciousness or knowledge, personality or vision, normally functioning mental functions are disrupted or broken. Dissociative symptoms may occur when one or more of these functions are impaired. The symptoms can be mild, but they can also be severe enough to impair a person's overall functioning, both in their personal life and at work.
Hi Erin, this is just a note to say hi. I don't know who I am, but I know I'm around 16, 17, and I don't know my name, but I just wanted to show you that I've got the sensory box, I've got the oils, and I hope you come back soon.
True, this is extremely uncommon. This can happen to anyone at any age. It is more common in women than in men. So, do you want to know what the causes of this? This is characterized by a history of trauma. In approximately 90% of the cases, there are history of harassment, extreme mental, physical, and sexual abuse was often involved in the trauma. Accidents, natural disasters, and conflict are also possible causes. This is often regarded as a coping mechanism that allows a person to withdraw from a stressful or traumatic event or to distinguish traumatic memories from normal awareness. It's a way for a person to disconnect from the outside world and put distance between themselves and what's going on.
However, dissociation may be used to protect yourself from physical and emotional discomfort of a traumatic or a stressful event. And dissociation allows an individual to retain a reasonably stable level of functioning as thought as the trauma never happened by separating a traumatic memories from everyday thoughts processes. And DID episode can be caused by a wide range of actual and symbolic traumas, including minor incidents such as being in a minor car accident, adult's injury, or even stress. When the parent's child reaches the same age as the parents, it can serve as a reminder of a childhood violence.
Person's normal personality and known as alternative personalities or alters are two or more separate and distinct personalities that a person with DID has. When an alter takes control of a person's action, the person can experience amnesia. Each alter has unique characteristics, a backstory, and a way of thinking about and interacting with his or her surroundings. An alter can be a different gender, have a different name, or have a different set of manners and tastes than you. An alter might also have allergies that are different from the core person. Other personality states and memory of occasions when an alter is dominant can or may not be apparent to the individuals with DID. A blend between alters may be triggered by stress or even a reminder of a trauma. An individual with DID can benefit from a specific change in certain cases. DID often causes chaos in one's life as well as issues in personal and professional relationships.
A woman with DID, for example, can encounter people who seem to know her but whom she does not recognize or recall ever meeting. Alternatively, she can discover things in her home that she does not recall purchasing.
You can't get rid of DID. You can never even get rid of an alter. They're always going to be there.
So these things happened to you when you were a kid, and then through your teens and early 20s, you were experiencing symptoms of DID, but it was undiagnosed. And then you went to therapy, got diagnosed with DID, and you total have 11 alters, 5 of which are primary, but 1 used to come out every day. Let's start with her.
Okay. So she is, her name is Minnie, and she's a 3-year-old girl.
And that's one of your alters.
She's one of my alters. And
now, is she you when you were 3?
No. So she was like the first one. The next one that ended up coming out was Devin. And Devin is Minnie's caretaker, if you will. So if there's something that is happening that a 3-year-old shouldn't be seeing, she'll take over instead.
As you can see in this video, Ensina are telling us that how many alter personalities that she have in her body, and a woman with DID may repeatedly meet people who seem to know her but whom she does not recognize or remember ever meeting, or she may find the items around the home that she does not remember buying. DID share many psychological symptoms such as those found in other mental disorders, including changing level of functioning from highly effective to disabled, severe headache or pain in other parts of the body,
Depression, anxiety, eating and sleeping disturbance,
Substance abuse, amnesia, and hallucinations.
If the symptoms are present, a full medical history and physical examination will be performed as part of the assessment. Various diagnostic tests such as blood tests or imaging such as X-rays, CT scans or MRIs can be used to rule out physical disease or drug side effects, despite the fact that no laboratory tests may detect dissociative disorder medically.
If there is no physical illness is found or discovered, the individual can be referred to a mental health professional who is qualified to identify and treat mental disorder, such as a doctor, psychologist, or clinical social worker. A psychological interview will be conducted to provide a complete image of the person's past experience and present functioning. Some psychiatrists and psychologists may apply specialized tests, for example, the dissociative experience scale, which is DES, or a standard interview such as the structured clinical interview for dissociation, which is SCIDD.
The aims of DID treatments are to ease the symptoms, ensure the individual's and others' protection, and reconnect the various identities into a single, well-functioning identity. Treatment also helps to assist the individual in safely expressing and processing traumatic memories, learning new coping and life skills, regaining optimal functioning, and improving relationships. The most effective treatment strategy is determined by the person, the nature of any identified causes, and the severity of the symptoms. Treatment will most likely require a mixture of the following methods, which are psychotherapy, sometimes called talk therapy. Psychotherapy is the main treatment for dissociative disorders. This is a broad term that includes several forms of therapy.
Secondly, cognitive behavioral therapy. This therapy is a form of psychotherapy focuses on changing dysfunctional thinking patterns, feelings, and behavior. Third, eye movement desensitizations and reprocessing, or also known as EMDR. This technique was designed to treat people with persistent nightmares, flashbacks, and other symptoms of post-traumatic stress disorder, or also known as PTSD. And fourth is dialectic behavioral therapy. Dialectic behavioral therapy is a form of psychotherapy for people with severe personality disturbance, which can include dissociative symptoms that often occurs after an experience of abuse or trauma. Fifth, family therapy. And family therapy teach the family member about this disorder as well as helping the family members to recognize symptoms of reoccurrence.
6. Creative therapies, for example, art therapy or music therapy. These therapies allow patients to explore and express their thoughts, feelings, and experience in a safe and creative environment. 7. Meditation and relaxation technique. This helps people to better tolerate their dissociative system and become more aware of their internal states. 8. Clinical hypnosis, meaning a treatment method that uses intense relaxation, concentrations, and focused attention to achieve an altered state of consciousness, allowing people to explore thoughts, feelings, and memories they may have hidden from their conscious mind.
People with DID generally respond well to treatment. However, treatment can be a long and painstaking process. This usually begins by identifying and empowering all personalities to help integrate them into a full functioning whole. To improve a person's outlook, it is important to treat any other problems or complications such as depressions, anxiety, or substance abuse. So now you already understand and know what DID is? Thank you.
For watching
Our montage video.
Till we meet again. Assalamualaikum warahmatullahi wabarakatuh.